Welcome back, folks, to Free My Pain Now with Dr. Matt Doduro. I think this is episode 15. So we're excited. Today we have from Greenville, South Carolina, Dr. Joseph Cipriano.
How you doing?
Good, good. Thanks so much for making the trek down here. And Dr. Cipriano comes, he's pretty famous on the internet and on YouTube.
Correct.
Right? You've done some wonderful things, and I've been a big fan of your work and what you've done to build your base. and now you have people that fly all over the country to come in to see you.
Yep.
But first, let's get to know you, Dr. Joseph. And you got into chiropractic kind of through the medical field?
Correct. Through the medical field, I was working on a med-surg floor as a nurse assistant years ago when I was working on my undergrad. But the patients that I dealt with, it was horrifying to see. You know, it was patients going through diabetic neuropathy, open heart surgeries, and I was dealing with pre and post-op, just taking care of them, measuring vitals. And what really got me into chiropractic was I wanted to be able to help a patient before they got to that point in their life. So chiropractic, obviously, as you know, if you can, get people's nutrition on point, diet, exercise, just everything in the right direction, they would never be at
Right.
that point in place at that time.
And so much of our healthcare system today is crisis care.
Correct.
Right? And you were seeing that firsthand in the trenches. And it was your dad who said, hey, you need to get into healthcare?
Yes.
I love that story.
Yep. Baby boomer, of
Uh-huh.
course, in the construction field. And he knew, he's like, obviously, the world is always going to need medical professionals. They will always need that. And just my course went to chiropractic.
That's cool. My dad was the same way. He owned a shoe store, and he told my brothers and I, they're always going to need podiatrists and chiropractors. And so, and he loved, obviously the feet and shoes. So you went to Life University, graduated from...
Yeah, it was Life University in 2016. And from there, I have been all over. But I would say one of the biggest clinics where I was at originally was the first position I took out in the Woodlands, Texas.
With Dr. Chris Zano.
Correct.
At the largest chiropractic clinic, definitely in the country, maybe the world.
Correct.
Right?
Yeah, at that time we were seeing about 2,000 patients a week in that office. So,
Wow.
yeah, working that firsthand with Dr. Zano was huge.
Yeah, and he's amazing. And really you got to really work on your chiropractic skills and your adjusting, and to see that many patients, and they do it in such a way that people don't feel like it's rushed in any way. I mean, they do a wonderful job. And so going from Dr. Zano, who works really, really hard and sees a lot of patients, you're like, I want a life.
Correct. Correct. That was one thing. It's, you're putting a lot of time in, you're investing a lot of time, and then you don't have as much free time. So I wanted to have a good balance of both. Obviously, you want the patient to become healthier,
Mm-hmm.
but then you also, want to have time to spend with your family and children as well.
The balance is so important.
Yep.
And so the thing that really draws a lot of attention to you is your adjustments. You actually film them and then put them on YouTube. I mean,
Correct.
And tell us how that whole thing started, because it's kind of...
Well, all right, I'm not going to lie, but if I don't mention my sister on this one, because she was the one who kept pushing me to film videos. So Lady Luck HQ on YouTube.
Uh-huh.
She was the one who got me to start filming. I honestly didn't think it was ever going to take off. I found it as a joke. I started off adjusting family members on the beach and friends on the beach, or wherever I was vacationing. I'd bring my portable chiropractic table, and it started taking off.
Mm-hmm.
It got to the point where, I'm a couple 100,000 subscribers. Like, people are contacting me, where can I schedule appointments? How do I do this? And I was always working. I was managing another office, and it got to the point where I had to open my own office. And obviously, you've been there on Greenville.
It was a beautiful building. You're in such a great spot in downtown Greenville.
Yep.
And you've really built a wonderful clinic. And, close to 1 million subscribers.
Correct.
You should probably hit that by mid-November.
Yes.
Which is, an unbelievable feat. And, I've said it before, but I think, and I want to put it on record, I think you've done more for chiropractic than many people in the last 25 years. And kudos to you
Thank you.
and your lovely wife for, having both the talent and the discipline to actually put these together. I mean, it's not, I know what it's like to edit and things like that, and I'm not good at it. So what you guys are doing is pretty cool. So the thing that I notice is that I think less than 10% of the population has actually ever visited a chiropractor.
Correct.
And I mean, to me, you're putting chiropractic into the limelight. You've really done a wonderful job at not only educating your patients, but the population that's watching and following you about the benefits of this.
Yep.
So tell me a little bit about your thoughts and your philosophy on that.
Well, the one thing and the reason why I like to film all of my sessions is a lot of people don't realize, but other people out in the world are experiencing similar symptoms. And the traditional methods, people, they go to their medical doctors, they get put on a prescription medication, and that's been the normal route that patients have been doing for
The
years.
standard of care.
Correct. People don't realize that chiropractic care can help with other things besides back pain. I have patients headaches, migraines, digestive issues, asthma, allergies. I mean, you name it. I've. It's crazy. My wife, not even being a chiropractor, can't believe all the conditions that I help with. But what I'm doing, especially while I film things, is people actually see others getting better. And that's the whole point. And when people start seeing others get better, then they start realizing, oh, wow, maybe there is something else out there that I can do.
You touched on a couple great points. Number one, when people see that and they're like, wow, that young lady's just like me, and I'm having the exact same problems. And even though, the adjustments can be somewhat, I don't, what's the word I want to say? Not, I mean, they're powerful.
Yeah.
And so, we've kept it really secure and like, don't ever show anybody cracking there, whatever. But you've done a wonderful job at bringing that to the forefront and just sharing again, more people. I love the thing at your office. He's got a big board of the world, a map of the world, and they have little pins from where everyone has come. And it's really neat to see what you're doing and how you're an ambassador for chiropractic. So keep up the great work there.
Yeah, thank you.
So what are your plans? What do you see this? Like the really cool thing that I think is not only do you give a wonderful full spine adjustment, but at the end, the cherry on the top is really your Y-strap adjustment.
Correct.
And for people and listeners out there that don't really understand, can you explain what that process is?
Yeah, so I use a Y strap. Basically, it's a strap used for spinal decompression. The strap goes around the base of the occiput, and I decompress in that Y axis. So I'm tractioning out the spine, and I'm removing pressure off the nerve roots, going from the cervical spine all the way down to the sacrum.
So in the Cortesian cortex, it's Y-axis, X, and then Z.
Correct.
And the body will translate or flex along those three axes. So you have the cervical thoracic spine. There's 7 vertebrae there.
Yep.
There's 12 thoracic vertebrae, 5 lumbar. And you're really looking to move everything.
Correct.
And we always say one of the things that we talk about on the show is our body lives from motion.
Yes, it does.
Okay.
100%.
And every organ, every joint. So if things get locked up, I think, and I can't remember the exact keynote speaker, but from International Pain and Spine back in 1999, and he was the keynote speaker, who was a medical doctor, and he said 97% of back pain is from a mechanical stress. So what's a mechanical stress? For our listeners out there, take your index finger and extend it back. That is painful. That is pain at the joint. Now, the other 3% of pain in spine and spinal-related issues comes from tumors, fractures, cancer.
Correct. Yep.
So, we've got a good percentage here that a lot of these are from mechanical stress. Now, call it what you want, a subluxation,
Yep.
a slight dislocation,
Yep.
but that subluxation can cause mechanoreceptors to be under pressure, and it can cause pain and discomfort.
Oh,
So, chiropractors offer a mechanical solution to a mechanical problem, and I think you're doing it more efficiently and effective than anybody that I'm seeing right now. And I loved the experience of going through your adjustment, because what happens through life is gravity. And and I'm gonna for our camera, our videotapes. I mean, we should have head should be over shoulders, shoulders should be over hips. We should have a nice curve in the neck, one in the mid back and one in the low back. From the front, everything should stack one on top of the other.
Yes.
So when a patient is like this or this,
Head forward.
we'll talk about tech neck next episode. But those are all mechanical stresses. So not only do we want to correct that mechanical stress, but then we want to train the body to back closer to that normal position or normal posture.
Yes, exactly.
So you have some training also with Pedibon or
Yep.
CBP?
CBP, Pedibon, I mean, and then your full spine, Gonstead, Thompson.
And these are the different techniques that we utilize.
Correct.
And the thing I love about chiropractic biophysics, and a nice shout out to Don Harrison, who is the founder, and his son, Deed Harrison, they've done unbelievable amount of research to really prove what that ideal spinal model is. So I always say, in God we trust, all others bring data. So what is the ideal position? Just like we have a normal blood pressure of 120/80 or a normal body temperature of 98.6 degrees, there's a normal position for your spine. Some of these people, they've been injured and then they heal in this position.
Yes.
And I think that's where you're making the biggest impact on those patients that have had trauma for a while and then they've healed in that abnormal position.
Yep.
So how do you go about working with someone who's had a terrible scoliosis for 5 to 7 years? I mean,
Honestly, so when I go through the adjustments, I will bring back to alignment as closely as I can with the adjustments until I get them to do the Y strap, that decompression. Once we use that decompression,
Boom.
that's where people really feel the relief.
We'll pick that up on the next session. Thank you. All right, so welcome back to Free My Pain Now with Dr. Matt DeDuro. We have a wonderful doctor from Greenville, South Carolina, Dr. Joseph Cipriano. Is that Italian?
It is.
All right, good. Nice paisan. So we were talking about the adjustments and the impact, and so how is our profession actually looking at you? I'm sure you're getting good, bad, and different.
Yes, correct. I get both. I get a lot of chiropractors out there that absolutely love what I do, love what I'm doing. I have friends over country, out of the country in Norway, Sweden, Iceland, and they have actually told me, because people have seen my videos, they've actually gone in to their clinics and have even brought up, hey, do you know this guy? And funny that they're like, oh my gosh, we went to school together. But I hear this from all over. I get doctors that email me and say, hey, thank you. I've actually got 5 new patients in 1 week because people see your videos, and now first-time chiropractic patients, they want to experience, what a chiropractic adjustment is like.
Mm-hmm.
But then I also get other chiropractors out there that think what I'm doing is absolutely horrible for the profession, which all I'm trying to do is just create awareness.
Anytime you come in and you shake up the norm, and I'll give you a quick example. I was in New York for the first 12 years practicing, and I remember in New York in 1998, they started allowing us to use testimonial ads. Before that, it was illegal in our profession in New York to run testimonials. So I was at the forefront, and I was waiting for the law. Once it got passed, I start advertising. I used the killer ad by Dr. Bob Manna out of Rome, Georgia, and it was amazing. It told my story and my wife, and it showed pictures of our daughters, and it worked.
Yeah.
And I had other chiropractors that actually turned me into the New York State Professional Office of Discipline.
Wow.
And I had people show up in my office and saying, hey, what are you doing with these testimonials? And I'm like, well, it's a new law as of January 18th, 1998. We can do that. And so they're like, oh, even the agents that work for the state didn't even know it. But it seems like any time that you do something that's out of the norm, I mean, when you graduated, you can't just hang up a shingle and think that people are going to be pulling in. I mean, those days are gone.
Correct. Yeah, no, I mean, ever since I started filming adjustments, one, I've had other people out there mad that I filmed these adjustments, and then I'd have others that were mad because I wasn't doing a specific chiropractic adjustment, meaning just like an atlas adjustment or just
Right.
one specific segment, because that decompression, when you get that Y strap done, you're getting multiple segments that are actually moving and decompressing in one whole.
Again, gravity, the more we're out there, I mean, our body goes from this to this to this as we get older, and our head is 10 or 12 pounds, and so you want it in a good position. And I always catch myself, like my posture on this is probably, I need to focus on it. I have 3 daughters, and I'm like, you're chiropractors. You guys have to have wonderful posture. And they know how excited it is when they're work. You have to work at having good posture. It
Yes,
doesn't
you
just
do.
come easy, just like anything in life.
Yep.
So you're doing these adjustments. You've definitely shaken up our profession. You've done you've done more for chiropractic, I think, and bringing us to the forefront. And I know a few years ago, Life University was like, once you get to that 17%, the tipping point, the rest of the population will come in. But we just haven't seen it. I haven't seen it in 25 years of being in practice. And I think it's just refreshing to have young docs like you that are bringing us to the limelight.
Yeah, I mean, a lot of people nowadays, their first line should actually be going to your chiropractor. And I'm not gonna lie, chiropractors should be working hand in hand with physical therapists. When you get the joints and the bones aligned to where they need to be, then you can have the physical therapist go in and actually work with, the stretches, the exercises, things in that case. But pills and surgery, should be at
Last
the
line,
end. Yes.
sure.
Because once you do surgery, there's literally no turning back after that.
And I get calls all the time from different patients. And by the way, you do a wonderful exam. I mean, you don't film the exam because nobody wants to watch an exam.
Correct.
But I mean, I think you cover all the bases. I mean, you knew my history, you knew what happened, and so it's not just the adjustment. You're looking at their history. You're putting together, when their traumas were, and between you and I mean, most times you're seeing these injuries related to some repetitive issues or trauma. What are you seeing with most of your patients?
Of course, I get a lot. I mean, I'll have truck drivers, construction workers, nurses. I even have osteopathic surgeons that are patients of mine. Granted, they don't want to be filmed, which but I have medical doctors in the clinic all the time, and you'll tend to get when it comes to truck drivers tend to have poor posture and a low back pain.
Mm-hmm.
That's the same thing. Obviously you're sitting for such, many hours a day, and you're in that truck and the seat is bouncing, and you tend to see certain professions with certain type of issues. When I have hairdressers come in, guess what?
Brachial plexus,
Yep.
upper neck and shoulder.
Correct.
Well, sitting is the new smoking. I mean, they said there are people who sit for 8 hours a day and what it does to their body. So again, we're getting people up, we're getting them moving, we're creating that life back in their joints, and again, removing those mechanical stresses that can wreak havoc. And obviously, we have. I mean, you were at my office today.
Yes.
We have a very awesome multidisciplinary clinic with 3 medical doctors, 2 nurse practitioners, therapists, MAs. I mean, you see how we
Work together as a
Yeah.
team.
and that is the future. In our next episode, well, maybe we'll talk about it now. I mean, there was. Do you remember the Chester Wilk case by any chance?
A little bit.
So Chester Wilk was a chiropractor who actually in 1988 he sued. I'm serious. The first suit was 1976. He sued the AMA, the American Medical Association, because in their handbook they actually had a line that said medical doctors could not work with or refer to chiropractors. And it sounds crazy now, but I was lucky enough when they actually decided it in February 7th of 1990, that was a really big turning point for chiropractors. I mean, they said the AMA held that it was unethical for medical doctors to associate with an unscientific practitioner and labeled chiropractic as unscientific cult. Now, you know what it's like to go to chiropractic college. It was one of the hardest things I've done.
Oh my gosh, same here.
So, I mean, when we look at it's a 5-year program smushed into 3 years and 9 months.
Correct.
And so we don't take summers off. We take, I think, 2 weeks off in June, 2 weeks off at Christmas, but we work year round going to
Yes.
school. And our degree, I mean, we take almost exactly the same as a medical student. The only difference is we don't have any pharmacology, and we don't take any, obviously, surgery. But our radiology is higher.
Correct.
Our orthopedic testing is higher. I taught at Life University for a couple of years, so I know what these young students have to go through. And we actually take 4 parts of a national board
Yep.
to be certified in different areas. And that is not a board certification, I want you to know. That is just we're passing our national boards. Medical doctors go on and get board certification in, say, orthopedics or pain management.
Correct.
The chiropractors were passing a national board qualifying to allow us to practice in each state. So it was a pretty groundbreaking case. And, you know, in 1980, the AMA eliminated that principle number 3 and made major revisions of their ethical rules. Its replacement stated that a physician shall be free to choose whom to serve, with whom to associate, and the environment in which to provide medical services. Thus, the AMA now permits medical doctors to refer to patients to doctors of chiropractic for such manipulative therapy, if the medical doctor believes it is in the best interest of the patient. So, I mean, that took decades to come across. And we're on the good end of it, right? We started school and became doctors after that.
Yep.
So, you know, in our next segment, we'll talk about some of the skeptics out there and how do we change that, right? People are scared to go to chiropractors. They're like, you're not going to crack my neck. I mean, and as much as it's counterintuitive to what you've done, it's actually working. And I think it brings the fear of that crack.
Yes. I mean, so many people, as sad as it is to say, they've watched too many kung fu or karate movies, and they see the wacha and then just
Jean-Claude.
yeah, and then they break their neck and they die. And I feel like so many people have seen that, and they just feel like chiropractic, like that's what a chiropractor is going to do, is this one manipulation, and then the patient,
And there was some bad press back even when I was in the mid 90s, and it was one lady out of Toronto, and she did a self manipulation on her neck, and she ended up having a stroke and passing away. And the headlines in the paper was chiropractic manipulation, right? And so, but they do say that 3% of all strokes, I mean, it doesn't matter. They can walk into a hospital. They can walk into the hairdresser and bend their head back. It's just like you have to know those signs. And that's the thing that I thought that the chiropractic colleges allowed us to screen those people. So again, 3% of the population is prone to those type of aneurysms or strokes.
Correct.
If they come into your office and then they say, oh my gosh, it's the worst headache I've ever had, or this neck pain is unrelenting, some red flags should come off. So, or go off with you. So, I think those are important things that the schooling and the preparation that we get is really superior to anything else that's out there.
Yeah, the knowledge needs to be there. And then, I mean, as my wife knows and everyone knows in my practice, unfortunately, but there are some patients that I just will not adjust. I've got to take precaution on my end as well. And then obviously I don't want to cause any harm to a patient.
In our next segment, we'll talk about some of your successes and some of your great stories and some of the views that have had over 9 million views. So we'll be right back.